Okay, we're going to go ahead and get started today. So, good evening, everyone, and welcome to today's webinar. I'm Donna Rice, the Chief Operations Officer at Diabetes Sisters, and I am so glad you're here. And I just want to actually say, give a big thank you to our sponsor, who is Eli Lilly. We really want to extend a heartfelt thank you. They have been so committed to supporting women with diabetes and really helping to advance education in this important area. So the topic of weight management has really evolved dramatically with the introduction of the new weight loss medications. These therapies have truly reshaped how we think about, discuss, and approach weight management, which is why today's session focuses on this new kind of landscape of care. So we're thrilled to welcome our speaker, Dr. Victoria Bouhairie. Dr. Bouhairie is board certified in endocrinology, diabetes and metabolism, as well as in lifestyle and obesity medicine. She is truly an expert in this area. She is also the founder and CEO of Perry's Wellness Center in Charlotte, North Carolina, and a passionate advocate for diabetes care and health equity. Dr. Bouhairie will be answering your questions at the end of her presentation, so please type them into the Q&A box as we go along. We have a lot to cover today. She has some great information in the slides, so let's go ahead and get started. So please help me in welcoming Dr. Victoria Bouhairie.
Well, thank you. I am going to share my screen here. You can let me know if you see it.
You should be fine.
Okay, perfect. All right. Thank you again for that welcome, and welcome everyone to today's session. I know obesity and weight loss medications are now a pretty hot topic. So please, at the end, ask any questions that you have, or lingering questions, questions that you had before coming, and I'll do my best to answer before the end of the hour. So today we'll talk about GLP-1 medications. I know you've heard a lot about that. We'll talk about how they work. We'll talk about who will benefit from it, especially with women with diabetes, women with insulin resistance. We'll talk about safety and side effects of not just their GLP-1s, but the other obesity medications. And then finally, how can you advocate for yourself? So those are some of the things that we'll talk about today. So what is obesity? There are a few things I want to highlight when it comes to obesity. In case many of you don't know, obesity was coined a disease in 2013. So before that, for a very long time, it was thought to be a lifestyle condition. But what we know now is that it is actually a chronic disease, just like type 2 diabetes, just like arthritis, just like high blood pressure. And it's important to realize that just like any chronic disease, it is in fact a long-term health condition, right? It's chronic. And it is what we call relapsing, meaning that it can come back if it's not treated appropriately, if it's not maintained well, it can come back. It is indeed from an abundance of what we call adipose tissue, and it can affect the way that your body functions. And that can be what we call metabolic, so the way your heart functions, the vessels around your organs, increase inflammation. It can have psychological complications. So there are many, many factors that comes to having obesity. When we talk about how we define it, we typically use what's called the BMI, body mass index. And it's a calculation that we take using your weight as well as your height. Overweight is considered to have a BMI of greater than 25 and above and less than 30. And then class 1 obesity is from 30 to 34.9, class 2, 35 to 39.9. And then finally, a BMI of greater than 40 is considered class 3 obesity. It is important to know that for the Asian population, the cutoff when it comes to both overweight and what we define as obesity is actually lower. And the reason why it's lower is because we have found that we see these chronic health conditions at a much lower weight for the Asian population than for the other general population. So the Asian cutoff for overweight and obesity is different. We all know that unfortunately, this has truly become an epidemic, where now 1 in 5 children have obesity, and then one in 3 also adults struggle with obesity. So unfortunately, the numbers in which we're diagnosing obesity, both in children as well as adulthood, have increased over the years. The cost of also treating obesity has increased. What we know is that in 2020, the economic and social impact of obesity was about 97 billion. And now this is actually projected to increase to 1.4 trillion. The burden of obesity exists, and that is multifactorial. The many aspects of which obesity can cause problems, and that can be from the brain, where it has increased risk of developing stroke, increased risk of depression, what we call sleep apnea, which is some problems sleeping, reflux disease. You can have different types of skin conditions, infertility, joint pain, really a host of problems when it comes to living with obesity. It is very important that we understand how the hormones work whenever we have, or really how the hormones work when it comes to weight regulation. What are these factors, and exactly how do they have an impact when it comes to obesity? The slide here has the key hormones when it comes to weight regulation. Ghrelin is a very potent hunger hormone. Okay, so what it does is that it increases your appetite, it decreases energy expenditure, and then you have a list of other hormones. All this is from the gut that counters ghrelin. And these include what we hear popularly GLP-1s as well as GIP. But these other hormones also play a huge factor when it comes to weight regulation. So you have one very powerful hormone that stimulates hunger, which is ghrelin, and then a host of other hormones that try to counter it. It's going to do the exact opposite of what ghrelin is doing. And the body really listens to these gut hormones. The brain receives the signals from the body. Are you in a starvation state? Are you in an overfed state? It's also very important to realize that ghrelin is abnormally increased whenever you have obesity or type 2 diabetes. So at baseline, ghrelin levels are very high. So what that means is that those who have obesity or type 2 diabetes are going to be hungry more often than those who do not. And also, after you eat, those ghrelin levels actually don't come down to normal as compared to somebody without obesity. So that means that you won't feel as full after you eat. You're going to feel hungry again after you eat. So there are many, many underlying hormonal factors when it comes to having obesity. And it really comes back to that definition that indeed obesity is a disease. And we always have to remember that because we should treat it as a disease. And unfortunately, there's a lot of stigma that's attached to it, which we really don't see with other chronic diseases such as hypertension or even diabetes. When it comes to the treatment of obesity, it is important to realize that it really is holistic. We have to take a look at everything, including lifestyle. All the major societies, the Obesity Medical Society, the American Diabetes Society, the American Heart Association, all of them say that we should have lifestyle modification as the foundation of obesity treatment. So that means we really need to look at nutrition. What are we eating? We really need to look at physical activity and make sure that we're enhancing the amount of physical activity as we treat obesity. And also behavior modifications. we really have to make sure that we're concentrating not just on medications, but on these different lifestyle factors. And on top of that, we can put medications. So again, it's really a holistic way of treating obesity, a holistic way, in personal way actually, of treating obesity, as well as these other chronic diseases such as type 2 diabetes. So let's talk about GLP-1. And as I mentioned, that this has more or less become a buzzword over the last few years. There are different types of GLP-1 medications. We have semaglutide, commonly known as Ozempic or Wegovy, liraglutide, and this is commonly known as Victoza or Saxenda, dulaglutide, which is Trulicity. And then tirzepatide is actually a medication that has GLP-1 and GIP. So two different medications in one, and that's your Mounjaro or Zepbound. Now, as I mentioned, GLP-1 is a natural hormone. The gut produces GLP-1. It is produced not as much in obesity as well as type 2 diabetes. So when we give GLP-1s, we're actually supplementing that decrease in GLP-1 that exists in obesity. What it does is that it slows your the emptying of your stomach, and really that helps you to feel full much sooner. It's because your stomach is not moving as fast as it otherwise would. It also goes to the brain and talks to the brain centers, the hunger centers, and tells the hunger centers, um, to be less hungry, that you should be full or increase the satiety. It also tells your pancreas to release insulin whenever you eat. So again, the pancreas is a hormone, normally releases insulin whenever we eat, especially carbohydrates. But GLP-1 actually helps the pancreas to even release more insulin after you eat. And then finally, it lowers what's called glucagon. And glucagon is a hormone that increases your blood sugar levels. So the GLP-1 medication actually works through a lot of different mechanisms, which will ultimately make you less hungry, make you feel full sooner as well as longer, and ultimately helps you to lose weight and also control your blood sugar. The GIP, so if you remember the diagram that I showed you, all those other hormones that were countering ghrelin, so GIP is another hormone. And GIP is in the Zepbound, the other GLP, GIP medication that I mentioned prior. GIP is an incretin. It's just like GLP, but the function is a little bit different. It does help GLP increase the amount of insulin whenever you eat. It has a different effect on glucagon, and it doesn't make you as nauseated as GLP does. And that is because when it comes to the stomach, it doesn't really inhibit that contraction of the stomach as much as GLP does. And then when it goes to the brain, it doesn't activate the nausea receptors as much as GLP does. So it really works very well together. And that's the reason why we see a really nice effect whenever we combine GLP and GIP. This goes into more details as to what it does. So again, the two medications, they increase the amount of insulin after you eat. I talked about less nausea when it comes to GIP and the fact that GIP is also going to raise the glucagon levels, which is different from GLP. And then GIP actually also helps with insulin sensitivity. So again, having the two of them is really where you're able to see that profound effect. There are a host of other weight loss medications, and I really want to emphasize this because again, the buzzword now are the GLP-1s or the GLP and GIP, right? So your Zepbound, your tirzepatide, your semaglutide. But there are other medications. Obesity was coined a disease in 2013. And we've been able to see many other type of medications that also do a good job. So this graph here shows the other type of medications that are available. You have orlistat, which is which can be an over-the-counter medication. This inhibits the absorption of fat. You have bupropion, naltrexone. That's a combination pill medication. You have phentermine and topiramate, as well as the GLP medications that I spoke about. And that's your liraglutide, semaglutide, as well as the tirzepatide. And the graph here shows the weight loss outcomes. So in green is the weight loss effect of each medication. So as you can see, there's really robust weight loss when it comes to the GLPs, which is here on the right-hand side. When we talk about highly effective anti-obesity medications, we're really referring to those medications that have the 15 or percent weight reduction. And this could be weight reduction that was seen in clinical studies or some type of clinically meaningful percentage of weight loss within clinical trials. Here's a list of the weight loss medications that I showed in the graph, and again, how it works. So Saxenda, liraglutide, semaglutide, Wegovy, tirzepatide, Mounjaro. These first three are your GLP one medications, and then the tirzepatide or the Mounjaro is going to have your GLP and GIP. So remember, though, that's the dual medication. The orlistat, this blocks the enzymes that help to digest fat, so that you don't have as much fat absorption. With this medication, you have to be careful about losing certain fat-soluble vitamins. So your vitamin A, D, E, and K. So a lot of the times, if I put somebody on orlistat, I'll make sure that they have a multivitamin to go with it. This one here, phentermine and topiramate. This one here is a combination of appetite suppressant, as well as another medication that helps to reduce cravings. So overall, you're going to eat less, and that will ultimately lead to weight loss. Now, naltrexone as well as bupropion, this reduces hunger and food craving, and this is through a brain reward and appetite pathway. You have to be careful if you're on opioids, as well as if you have uncontrolled blood pressure or seizure disorder. And then this one here, the semaglutide, sorry. So this one here is actually used for obesity that is inherited. So it's a very rare genetic form of obesity. So again, it's rare. We really don't use it much. If it is used, it's commonly used in children. They've been evaluated by an obesity specialist or a genetic specialist, and they've been diagnosed with, again, a very rare obesity syndrome. This goes through again, the different obesity options and also how the dosing looks like. So you have your GLP-1s that are injections. You have your orlistat, which is a pill. And then the Quizmia, Contrave, etc. All of those are pill form. The indication for these medications, we talked about BMI. So we always look for either BMI of greater than 30, which is the diagnosis of obesity class 1, or a BMI greater or equal to 27 with some type of obesity-related illness. And that could be hypertension, it could be type 2 diabetes, etc. I would tell you that there's no standardization when it comes to an obesity-related illness. So when you're thinking about insurance coverage, each plan will have its definition as to what they consider as obesity-related illness. And then the side effects, each medication is going to have a side effect. So it's very important that you discuss this with your healthcare provider. With GLP-1s, they can result in having some headaches and also a lot of your stomach issues. So you can have diarrhea, you can have constipation, nausea, as well as vomiting. Those really are the main side effects that you would have. The orlistat. So if you remember, these are actually inhibiting fat absorption. So what happens is that the fat is actually going through the intestines, and that can really lead to oily stools, cramps, and gas. Quizmia, that tends to have side effects of dry mouth, di diarrhea, inability to sleep, some tingling, and some people actually can become drowsy. Contrave, you have nausea, stomach issues, headaches, high blood pressure, and then finally, you have the medication for the rare genetic disease in which you can have skin discoloration, nausea, headache, as well as some injection site hypersensitivity. So, what results should you expect after you take these medications? Obviously, weight loss. I show the graph where that 15% weight loss tends to occur with the GLP-1s or the GLP GIP combination. But the other ones also do a good job. Other things that will come with the weight loss are improved blood sugar levels, improved blood pressure. You have improvements of your liver enzymes as well. Also expect to have some good amount of weight loss within the first 3 months. After that, things can plateau. And that it can take some extra support, maybe some changes in medications or what you're doing, in order for you to overcome the plateau. The body actually does adapt to some of these changes in weight. So when you lose weight, the body is going to say, "Oh my gosh, I've lost weight. Let me change my energy expenditure. Let me change my metabolic rate." So that weight loss becomes more and more difficult. So we actually do see a plateau after a certain point. And then stopping medications can lead to weight gain. It's very important that when you start the medications, you really start on that foundation of lifestyle, right? And making sure that we have that behavior component, that we're watching what we're eating, that we're exercising, and we have really adaptive, or we've been able to avoid some triggers that makes us want to eat. And having really a good support system is very important for that. So, what things do women specifically face? When it comes to PCOS, we do have evidence that the GLP-1s medications really has the best data when it comes to weight loss, insulin resistance, as well as improving the menstrual cycles and those high testosterone levels that's associated with PCOS. Typically, we use metformin for PCOS. That does help with insulin sensitivity. However, it's not really considered a weight loss medication, even though it does cause some weight loss. Overall, when it comes to fertility, we do try to avoid anti-obesity medication. So if you're planning on conceiving, you do want to make sure you let your healthcare provider know and then have that discussion to see what's the best way forward when it comes to obesity treatment. Sometimes it is better if you have obesity to lose weight before attempting to get pregnant, and that just helps with overall decreasing complications with the pregnancy as well as for the child. Whenever you're going to have some surgery, you might be advised to stop, let's say, for example, your GLP-1. As I mentioned, there's slowing of the stomach whenever you're on the medication. So we really don't want any aspiration to occur during or after surgery. So sometimes you might be advised to decrease dosage of obesity medications or stop it completely. Your bone and muscle are things that we really have to watch out for and make sure that there's no increased loss of bone, increased loss of muscle. When you do lose weight, you are going to lose some muscle. So that's something that you really want to make sure that you are doing increased resistance training in order to maintain that muscle mass. And then finally, if you're breastfeeding, we really do not recommend anti-obesity medications. uh, Really, at the end of the day, you really want to make sure you're having frank discussions with your healthcare provider, making sure that they know your history, making sure they know all the medications that you're taking, making sure that they know your plans for fertility, and also what have you done before whenever you with your weight loss attempts. That's helpful for even documentation when it comes to covering some of these obesity medications. So, how can you advocate for yourself when you go and see your healthcare provider? You know, uh, oh, whenever you think about your health and whenever you're going to see your healthcare provider or healthcare team, always remember that this is a partnership where you need to be listened to. Your concerns should be listened to and heard and addressed. And if you feel that that's not happening, then really try and find someone that you can feel that you're having that type of relationship with. So again, it's a partnership. So the health goals have to be set. It is very important that not all the time that we put somebody on a medication such as a GLP-1 is for weight loss. Sometimes it's for the other benefits of GLP-1. Studies have shown that it has benefits when it comes to your kidneys, benefits when it comes to your heart, etc. So sometimes we use these medications for those extra benefits. And also health. Whenever we think about weight loss, even a 5% decrease in weight loss has been shown to be beneficial when it comes to chronic disease and long-term complications. So the health goals for everybody might be different, and it definitely should be individualized from better energy, mobility, A1C levels, blood pressure. It's very important also that you come prepared. I mentioned before that make sure that your healthcare provider knows what things you've done in the past to help lose weight. If you did try medications, what side effect did you have? We definitely want to know the full picture. What is your overall medical history? And then, of course, what current medications are you taking? We want to make sure that there are no interactions between the potential medication that you get started on and then the medications that you're currently taking. And then you want to ask about options. If one medication is given to you that you might be concerned about due to side effects, it's okay to ask about these other medications. Again, GLP-1s and your GLP-1 GIP, they have the most robust data, but the other weight loss medications are also really good and can cause substantial amounts of weight loss. And then you want to ask, what should you expect? What side effects should you expect from these medications, especially looking at your overall picture? And then how should you manage them? You also want to know what does the long term look like? What support system does that provider have for you, especially around lifestyle and around healthy living? And then, of course, the labs and visits. So you really want to have a good plan in place before you leave the office. Cost and coverage. Whenever you go and see your healthcare provider, it's not all questions that they'll be able to answer, especially when it comes to insurance coverage, just because it's so individualized. It might be helpful that you either call your insurance company and see what medications are covered. Is a prior authorization needed? Prior authorization means more or less sending some paperwork to the payer for them to look through and see if you qualify for coverage for that particular medication. And also, what does your out-of-pocket cost look like? What is your deductible? What maximum do you have to go to before insurance starts to kick in? So these are very important questions that will be helpful if you have the answers to before you see your provider, just so that that interaction, that whenever you have this discussion around weight loss medications, it will be a lot more fruitful. Another thing is really you want to share your real life needs, your real what is going on in your life, the type of job that you have, your schedule. Do you have phobia for needles? If you do, then maybe injections won't be great for you. Maybe the pill will be a better type of medication for you. You want to think about your own budget, and if insurance covers it or if it doesn't cover it, what does that out-of-pocket cost look like for you? Are there any cultural considerations? You definitely want to let your healthcare team know if something culturally is specific, which might change the treatment discussion or treatment decision. And of course, we talked about pregnancy plans. If there's any plans for that, that's something that should definitely be communicated. I talked about making sure that you have a healthcare team that you trust, that you make sure that your concerns are being listened to and addressed. And it's very important that you agree on the plan. So again, this is not one-sided, making sure that both you and your healthcare provider have a very frank conversation around what's going on with your life, what medications that they would like to give you. And then you leave knowing what medication it is, what dose you're going to be on, what does the titration of the medication look like for you? Again, what does follow-up, etc. And sometimes, unfortunately, there is still stigma around obesity, and some providers might just tell you no in terms of giving you weight loss medication. And if that is the answer that you get, you actually want to ask more questions. Why? Is there particular criteria that they're using that they maybe need more understanding? Make sure that, of course, your BMI fits. Remember, I told you a BMI of 27 plus some type of chronic weight associated complication, or a BMI of 31. And if insurance doesn't cover one type of medication that's recommended, you might want to ask what medication is covered as an alternative. And also, make sure they have access to your medical records. Should you seek second opinions, then you have everything at hand for the next healthcare team. Sometimes it's helpful to also bring a supporter, somebody who can come into the visit with you and be a second set of ears. Because sometimes when you're trying to absorb everything, it could be very overwhelming with the different type of medications, the different considerations. But having somebody else as an extra ear can be helpful. And then, of course, if possible, try and take notes. That's all I have for you today, and I am going to open the floor for questions.
Yeah, I just want to say thank you, Dr. Bouhairie. That was like amazing. And it was just so comprehensive, but so simple and easy to understand. And I just have to say, as a nurse and a healthcare provider, the three key messages that I really felt was really about that open communication, education. I'm just so thankful at Diabetes Sisters that we can bring programs like this because that understanding, knowing what you need to know and to have that conversation with your doctor is so important. And you brought up those points so eloquently. And look at shared decision. What works for you, what doesn't work for you. Having those really tough conversations with your healthcare provider can really help. And then lastly, really level setting on expectations. And I think I hear a lot about that as far as the expectations. And sometimes they're expecting great weight loss overnight or within 3 months and get really disappointed and as a result come off the medication. So I'm just really thankful for for just your thoughts and some of those tips that you shared. We have also put together a really nice tip sheet that's downloadable. If you've registered, you'll get that in the mail, but we do have some of this really information available for you as well. So again, I really like to open it up for questions and answers, and we have quite a few questions that have come through. So I am going to start those. And the first question is from an anonymous attendee, rebellious. It says it wasn't on your list, and it's also effective for weight loss. Can you comment on rebellious? Mhm.
So yeah, rebellious. If it's not on this one, it's on the next one coming up. So rebellious is a GLP-1. It's the same class as your semaglutide. and it's the pill form of the medication. Yeah, so it's effective. It's not as effective as the injection, but it's just the same as the pill form of semaglutide.
Okay, good. Okay, question number two. When using obesity medications, is there concerns that these medicines reduce cravings too much, that an individual doesn't get the nutrition their body may need to live a healthy lifestyle?
Yeah, yes, that's a great question. And it can happen. It can happen where people have such a suppression of their appetites that they're just not eating. And they're not getting enough of the nutrition that they need. So it's very important that, as I mentioned before, that follow-up, right? So I always recommend in my practice, and if a lot of the American Diabetes Association, Obesity Medical Association. I recommend that 1 month at least be seen again by your provider. Um, and of course, if there's too much nausea, too much vomiting, where you thinking that your intake has severely been compromised, you should definitely let your provider know sooner. But yes, there's definitely been instances where weight, the hunger suppression has been to a point where it can affect you or that person that is taking the medication for the long term.
Good, thank you. Question number three. Loaded question here, can people with type 1 diabetes take GLP-1 medications?
Yeah. So it's not FDA approved. So I'll start there. All right. So can they? Yes, but it's not FDA approved. There are studies that have shown benefits because as I mentioned before, obesity is a epidemic. So we are seeing more and more type ones with obesity. So um, of course, they will benefit from GLP-1s. And again, we do see the benefit that is there. Unfortunately, it's just not currently indicated for type 1 diabetes.
Very good. Okay, another question. What about children? You talked a lot about the obesity epidemic in children. What are some of the therapies that can be used in children and what ages?
So for children, you always want to make sure you start with lifestyle modification. So the recommendation, just like with the adults, you start with lifestyle modification. For the FDA approved medications, they start at the age of 12. Of course, you always want to consult with either your pediatrician, family medicine provider, what have you, in order to make these recommendations very specific for your child. However, currently the indications is for majority of the obesity medications for children. It's age 12 and above.
Have.
Yeah.
Great. Also, let's see, we have another question here. We talked a little bit about side effects and considerations. Is there anything in particular to be aware of when you have diabetes and using weight loss medications from a side effect perspective?
Yeah, it depends on which one you're using. With if you're on insulin, right, and you're on, these medications that, for example, causes appetite suppression, you really want to make sure that you watch how much insulin you're given. Either you're carb counting, or if you're not carb counting and you're on a set dose, but you're not eating a lot, that can lead to hypoglycemia, right? It can lower your blood sugar levels. So again, these are conversations you'll have with your healthcare provider. The GLP-1s in itself, if you're not on insulin, tends not to cause hypoglycemia, because as I mentioned prior, the way in which it works is it releases insulin in response to carbohydrates, right? So if you don't have carbohydrates in your system, then it's not going to have that effect of releasing insulin. But the other medications, so if you're orlistat, where that one is more of a fat inhibition of fat uptake. That in itself won't really change your blood sugar much. And then the other ones are appetite suppressants, etc. So the biggest medication if you have type 2 diabetes is going to be insulin. That would be the highest risk of having hypoglycemia, again, because you're not going to eat as much carbohydrates if you're on that fixed dose. If you're carb counting, that helps with that, right? Because you're not, you can um, tell if you're going to eat this carb or not. Or again, you might think you might eat and you may not. So being on insulin is going to be the biggest risk factor for hypoglycemia in addition to these other medications.
Right. Very good. Thank you. And another
Yeah.
question.
And I'm sorry, just
Oh, go ahead. Sure. Go ahead.
one more thing I wanted to stress. The GLP-1s, semaglutide, liraglutide, etc., those came out first as type 2 diabetes medications. So they were actually indicated for type 2 diabetes. And what we found was that using it, people are losing a lot of weight. So they went back into the clinical trials and realized that we can actually have this indication for obesity. So for some of these medications, remember, it was actually indicated for type 2 diabetes.
Good. Okay. Another question. Can GLP-1 be used in Hashimoto disease with type 2 and somebody who's insulin dependent?
Okay, so Hashimoto's disease, you're referring to thyroid disease. So I'm assuming the question is if you have type 2 diabetes and Hashimoto's thyroid disease, can you take GLP-1s? Is that what it
Yeah.
sounds
Can
like to you,
GLP-1
Dan?
be
Yeah.
used
So
in
so you
Hashimoto's?
can, yes. There's really no contraindication or risk for taking GLP-1s if you have thyroid disease.
Mhm.
That is actually common. We do see a lot of type 2 diabetes, people with type 2 diabetes that also have Hashimoto's,
Mhm.
and they're put on GLP-1s commonly. So that's not a contraindication. Whenever we think about thyroid disease and GLP-1s, there's a particular type of thyroid cancer that we used to see in rats, medullary thyroid cancer that we see in rats. We really don't see that. There haven't been any studies that have shown a link with humans. So medullary thyroid cancer, we don't see that link with humans. We did see it in rats, but not in humans. That's only related complication. But again, we don't see that in humans. But Hashimoto's, which is your autoimmune thyroid condition that causes low thyroid levels, you should be on a thyroid medication to supplement that. You can be on a GLP-1.
Perfect. Okay. Another question. Do all GLP-1s help liver enzymes or just certain ones? Which one is most beneficial for NASH or MASH? NASH.
Yeah. So the improvements when it comes to NASH, right now they've changed it to MASH, metabolic associated liver disease. The improvements from weight loss. So if you have weight loss in itself, you're going to have improvement of these liver enzymes as well as the liver function. Because what happens is when it comes to NASH or MASH, is really fat accumulation around the liver and its associated inflammation, which can lead to fibrosis, etc. So if you lose weight, removal of that underlying problem, then that's going to help. So across the board, the weight loss medications are going to help. But when it comes to the degree of weight loss, we just see higher degree of weight loss when it comes to those dual medications, your GLP-1, GIP. We see more weight loss with the GLP-1. So therefore, we see more improvement in all these associated comorbid conditions when it comes to obesity. There have been some studies that do suggest that there might be some other underlying mechanism that can help these liver diseases when it comes to the GLP-1s that we're yet to really find out exactly why. There's actually a lot of other things that we're seeing GLP-1 does that we're really yet to elucidate exactly how exactly they do it. But we are seeing additional benefit. So, the answer to your question, if you lose weight in general, you're going to see an improvement in those liver enzymes. And the more weight you lose, and that just tends to occur more with the GLP-1s, GIP-1s, um, then the more the more reversal of, or not really reversal, but the more improvements of those liver function tests and liver function itself that you'll see.
Yeah, and that's why there's such an emphasis now around that lifestyle and the weight reduction with MASH as well. So
Mhm.
really good points. Another question here, are there medications that can decrease insulin resistance that has been also exaggerated or exacerbated because of menopause? that can decrease insulin resistance. So thinking in terms of,
Yeah.
yeah,
So, okay, so the question is, I feel like it's a two-part question. Is
yeah.
there medications that can decrease insulin resistance and the effect of menopause? I think I'm hearing two different questions inside that. So let me go with the first one. Insulin resistance, we just have to go with the definition. That occurs really in the setting of obesity. Insulin resistance essentially means that your body's making insulin just fine, or sometimes there's a decreased amount, but for the most part, your body there's insulin present in your body. But when it gets to insulin resistance, it's how the cells respond to insulin. Okay, so what results what causes insulin resistance is fat accumulation within cells. So the first part of your question, which is what will help with insulin resistance, losing or decreasing the amount of fat cells around cells is going to help with insulin resistance. It's going to make those cells more insulin sensitive. When it comes to menopause, there are different changes in your hormones that occur that can also make you more insulin resistant. What we do know is that when it comes to these, as you age and changes in menopause, the lifestyle does help. The amount of sleep that you're having, what you're eating, the type of food that you're eating, how you're exercising also helps. Um, the GLP-1s and the GLP-GIP, they help with insulin resistance. And that's irrespective of if you have menopause or not. But definitely if you have menopause, that's going to be an additional help because it's actually more difficult to lose weight because I talked about this earlier, metabolic adaptation, which means that your body is essentially changing around some signals so that you can't lose as much weight. So your GLP-1s, they're going to be extremely helpful in both conditions. And then lifestyle changes are going to help too.
Yeah, good. Okay. That's why we always say 5 to 10 pound weight loss or 5 or 10% weight loss dramatically improves that insulin resistance. So
Correct.
good points. A final question, and an interesting question is, with a history of eating disorders, is the GLP-1 medications recommended? Question.
Yeah, so that's a loaded question. For the most part, we really don't like to give anyone that has an eating disorder any we're really careful, all right? Especially depending on the type of eating disorder. If you have a history of an eating disorder, that the being on medication can unfortunately worsen it. So we really want to make sure that we either address it and make sure that the eating disorder is treated, and heavily supervised. And after that, then we can see if given medications will be advisable. But for the most part, having an eating disorder, we really try to avoid some of these obesity medications. That being said, is again, is it being treated? Are you seeing someone for it? Depending on what medication you choose, you might be able to have some frank discussions and with close follow-up, you might be able to be on some that would work and won't worsen whatever type of eating disorder that you have. But again, if you have an eating disorder where you are purging, then we wouldn't want to give you a GLP-1 that is going to make you vomit. That would worsen your condition. So that is one that we are very cautious with when it comes to starting these obesity medications.
Yeah, interesting question. And I'm just thinking too, that's part of that conversation or those crucial conversations that you have with your healthcare provider. And oftentimes that's not asked, right? So in a routine visit, that might not even come up if you're like really exploring the kind of these weight loss medications. So I'm glad that whoever brought it up. A really good question. We
Mhm.
did have a final question just came in. Do you have any recommendations where we can get guidance to find affordable Medicare Part D insurance coverage for the GLP medications? Yeah.
Yeah. So, there's a short answer for this. There's a very long answer for this. I'm actually going to opt for the longer one just to give you understanding of the background. Okay. Um, the Medicare in itself, Part D, does not cover obesity medications. When Part D was established, and I believe this was 2003, they omitted obesity medications because obesity was not a disease at that time. And also, there were some obesity medications that were in the market that caused a lot of side effects. So if you think about it, Medicare 65 plus, you have obesity medications that were causing a lot of side effects, and they did not feel that putting somebody 65 plus on the medication was a good idea. So therefore, they did not put it on their Part D plan for it to be covered. Therefore, um, if you fast forward to 2025, that is still in effect. Okay. So if you have obesity by itself, Part D does not cover it. Um, but there have been recent studies that have shown that GLP-1 have heart advantages, so cardiovascular benefits. There's also studies that have shown that it improves what we call obstructive sleep apnea. Okay, so what Medicare or CMS has said is that because of these additional benefits, and so just not obesity, but obesity plus cardiovascular disease, obesity plus obstructive sleep apnea, we will cover it if you have those two conditions plus obesity. And there's some very strong clinical trials that supported this. So you can get, if you're a Medicare patient, you can get GLP-1, GLP, GIP, if you have one or two of those conditions with obesity. If you just have obesity by itself in any other complication, your blood pressure, PCOS, type 2 diabetes is different. But blood pressure, PCOS, that's not covered. Type 2 diabetes and obesity is covered under Medicare. So again, that was the long answer, right, to that question. I really wanted to give you that foundation as to why that is till today, that Part D just didn't cover it many years ago, and they still don't unless you have these additional long-term complications based on those trials.
Okay, very good. Well, that was the last question, and I just want to close out now, but I want to thank you so much for joining today's webinar. And if there's one takeaway, and it's really stay informed and stay connected with Diabetes Sisters, because we're here always to bring you the updated and the most evidence-based content and information. So we've also created a tip sheet to help you navigate this changing landscape of weight management. You can download it from our website. And we're excited to share that Dr. Bouhairie will be leading two follow-up workshops, one on October 22nd, which is next week, and October 29th at 7 p.m. So this is going to be an intimate, interactive session via Zoom, and Dr. Bouhairie will be there, and she'll be joined by women living with diabetes who will share their experience, a real-world experience with using these medications. So bring your questions, bring your friends, and really don't miss this opportunity to really learn together in a real supportive setting. So you can sign up for the websites on our sign up for the sessions on our website. And then before we close, I really want to give a big thank you to Eli Lilly for their generous support for this program and the continued partnership in empowering women with diabetes through education and community. And finally, a big thank you to our speaker, Dr. Victoria Bouhairie, and to all of you who took the time to engage and be dedicated to learning more about diabetes care. So everyone have a wonderful evening Enjoy the rest of the night, and we look forward to seeing you at our upcoming workshops next week. So thank you, everybody, and have a good night. Bye-bye.
Thank you, everyone.